Alice Meads for Nursing 482, Discussion 1. So the prompts this week asked us to think about a patient we took care of and three different aspects: pharmacology, pharmacokinetics, pharmacodynamics, and pharmacogenetics. This week, this last week, I took care of an intubated septic patient. One of the principles that come to mind after doing the reading was pharmacodynamics. So we had to keep this patient's blood pressure up. We started him on Levophed, also added dopamine, fluid resuscitation, added some antibiotic therapy, and then after getting the patient's blood pressure stable, I started bucking the vent, and so keeping him sedated without tanking his blood pressure became the next challenge. Along with that, we used Versed and paralytic to keep him safe. So there was a lot of titrating medications to achieve the response that I wanted, and so the pharmacodynamics, that is the part of pharmacology, is concerned with mechanism of action and relationships of drug concentrations and body responses. So this is the one that immediately stuck out in my mind when dealing with this patient. The pharmacokinetics also played a role in how this patient was treated. All of the drugs we gave were through the IV route. So distribution played a part because of his low blood pressure. This thing goes on to affect absorption, metabolism, and excretion of the drugs. Speaking again to pharmacodynamic principles, this related to, we were maxed out on dopamine, and then we were at the upper limit of Levophed when he started to respond to treatments. Throughout the reading, just made me think of the dose-response relationship and the frequency distribution curves. In this patient, how he must have been like on the upper end of those curves. Pharmacogenetics, obviously, I think it's a pretty new subject to me. And so, like the prompt said, I wasn't even a factor that was crossed my mind. But one area that it could have helped with this patient, is just one medicine wasn't working for him based on a genetic level, that you could give him another medicine that he could have responded more readily to. It's interesting read this week, and look forward to the rest of the class. Thanks.